My name is Charles Donahue, and this is the first of 3 lectures on my interest in infant mortality. After 2 years in the Peace Corps working in Malaysia in tuberculosis control, I went to graduate school at Cornell University. After Medicare and Medicaid were introduced in the mid-60s, the federal government was concerned with the issues of cost, access, and quality. Their solution was to set up state and 206 regional health planning agencies, called health systems agencies, with consumer majority boards of directors. Cornell was chosen as a site to train people who would work in these agencies. I received a 4-year fellowship to attend Cornell for their training program. I was in 3 departments: the sociology department, studying social organization and change in demography, the city and regional planning department, and the hospital administration health policy department. During one of my first lectures, the professor mentioned that the United States ranked 21st in the world in infant mortality in the late 60s, while spending the most money on healthcare in the world. 20 countries had lower infant mortality. There were questions asked in the United States concerning our high infant mortality rate and the lower rates in European countries in the late 60s. The American Medical Association responded often that the European countries had homogeneous populations. What they meant was mostly white populations. And the U.S. was heterogeneous, meant a lot of black and Hispanic populations. There were some challenges to this explanation for an obstetrician in New Hampshire who said they have a homogeneous population in New Hampshire and a high infant mortality rate. He didn't buy the AMA explanation. I decided I wanted to look into this. The U.S. government had publications that I had read on the health systems in European countries. I decided I want to go to Europe and meet some of the people mentioned in the publications in each country. I wrote a grant proposal to go to Europe for the summer, meet with some of the leaders in maternal and child health in each country. I decided to visit Holland, Denmark, Switzerland, the World Health Organization, and England. I lived in hostels and nighttime train rides to save money. The major difference between Europe and the United States was that everyone in Europe had health insurance. The big challenge was to get pregnant women to use the healthcare system early. Lower-income women and immigrants often didn't realize the importance of getting involved in prenatal care as early as possible. Major efforts were in place to reach out to these groups. In London, I studied at the library that is a part of the British Museum that houses the Rosetta Stone and the Elgin Marbles. I got a pass at the U.S. Embassy to allow me to use the museum's huge library. You would go in the morning and make a list of the books and journal articles you wanted and give the list to a clerk. A half hour later, they would deliver to your desk the materials you requested. In every request, there were yellow slips that stated, "Your request is not available." It was destroyed in the German bombing of London in World War II. Gave you a reality fix of the differences in countries. A major study was done in Great Britain looking at infant mortality. One finding was that infant mortality was higher where women were shorter in height. They thought it might be due to diet and income. There was one finding that was a surprise. One area where women were lower in height and had one of the lowest infant mortality rates in Great Britain was in Aberdeen, Scotland. When I got back to Cornell, I wrote another proposal for a 4-day trip to Aberdeen, Scotland, to find out what allowed them to have the lowest infant mortality rate with the highest risk women. The grant request was approved. I wrote Sir Dougal Baird, the director of the Aberdeen Obstetrics Program, and arranged to meet with him. It was a long train ride to Aberdeen in the north of Scotland. Every little village had a golf course on the way. So Dougal Baird said the main reason for their low infant mortality rate was the help they received from the Aberdeen Department of Sociology in their university. Albert Wesson, Ph.D., who later went to Brown University, was asked to do a study of both the women who had an infant death or a low birth weight infant. Sir Dougal Baird sent the risk factors found by Albert Wesson to hospitals and health clinics that saw women for prenatal care and asked that those women be transferred to receive their prenatal care at the main Aberdeen Medical Center. They were better prepared to access and reduce the risk of pregnancies during the prenatal period.